Greetings, everyone. This is Miss Gibson. We're going to be discussing communication and conflict management. So, communication. What is communication? Your ATI book on page 177 defines communication as a complex process of sending, receiving, and comprehending information being exchanged between two or more people. It is a dynamic and ongoing process that creates a unique experience for the participants. When communication breaks down, the result can be workplace errors and the loss of professional credibility. Communicating effectively is a skill that nurses must develop. Nurses use communication when providing care to demonstrate caring, establish therapeutic relationships, obtain and deliver information, as well as assist with changing behavior. Therapeutic communication is foundational to the nurse-client relationship. Effective communication is key to ensuring clients' safety. Poor communication, however, can lead to errors and safety risks. You have handoff communication, which is your SBAR, situation, background, assessment, recommendation, or request. You also have something that is called, let me move this, team steps, which is strategies and tools to enhance performance and patient safety. So with your SBAR, it is a formal method of communication between two or more members of the healthcare team. Situation describes what is happening at the time to require this communication. Background explain any relevant background information that relates to the situation. Assessment provides an analysis of the problem or patient need based on assessment data. And then recommendation or request states what is needed or what the desired outcome is. And then your SBAR, I reminds individuals to identify themselves. Your SBAR R, the R is response that the receiver provides based on the information given. And then SBAR Q, the Q stands for any additional questions that may need to be answered. We will use SBAR. Nurses generally use SBAR versus the other examples. Let's see, team steps. So the S stands for strategies and tools to enhance performance and patient safety. You also have some others there that I'll just briefly go over. You have cuss words, which is concerned, uncomfortable, safe. Checkbacks, which restates what a person said to verify understanding by all team members. You have call outs, which is a shout out with important information such as vital signs for all team members to hear at once. And then you have the 2 challenge rule. State a concern twice as needed. If ignored, follow the chain of command to get the concern addressed. So, like I said, the SBAR will be the one that you will use more than the others. Now we have our SBAR here is situation. What is going on with the patient? Here's an example. Dr. Lou, this is Alex, a nurse from your 5th Street office. I'm calling about your patient, Mr. Webb. He reports being in substantial discomfort and that there is not much urine in his catheter bag. Then, what is the clinical background or context? Mr. Webb is an 83-year-old patient that has a catheter in place during his recovery from bladder cancer treatment. Next, you have assessment. What do I think the problem is? He also reports a temperature of 100.4, that the urine in his bag is cloudy and slightly red. I'm concerned he may have an infection and that his catheter may be clogged. So let's move this down. Recommendation or request. What would I do to correct it? I would like him to come into the office this morning for you to see him. When he arrives, would you like us to get labs, including blood cultures, and check for infection? So I will tell you with the SBAR, in hospital settings, your EMRs will have templates that will be set up that assist you in each of these steps. So that's something that as you go in for your clinicals, make sure that you ask your preceptor how she does or how he or she does their SBARs. All right, I apologize. I have to keep moving my little screen around here. Interprofessional communication. So, interprofessional communication refers to communication with patients, families, communities, and other health professionals in a responsive and responsible manner that supports a team approach to the maintenance of health and treatment of a disease. You want to choose effective communication tools and techniques, including information systems, communication technologies. You want to facilitate discussions and interactions that enhance team function. You're going to organize and communicate information with patients, families, healthcare team members in a form that is understandable, avoiding discipline-specific terminology when possible. You're going to express one's knowledge and opinions to team members involved in patient care with confidence, clarity, and respect. Working to ensure common understanding of information, treatment, and care decisions. You're going to do some active listening, encourage ideas and opinions of other team members. You're going to give timely, sensitive, instructive feedback to others about their performance on the team, responding respectfully, of course, as a team member to feedback from others. You want to also use respectful language appropriate for a given difficult situation. You're also going to recognize how one's own uniqueness, including experience level, expertise, culture, power, hierarchy within the healthcare team contributes to effective communication. You're also going to communicate consistently the importance of teamwork and patient-centered and community-focused care. And this is discussed in Chapter 32 of your ATI. That way, after you've listened to this, you can go back and look at that interprofessional communication. So conflict management, what does this mean? Conflict management, opposing thoughts, ideas, feelings, perceptions, behaviors, values, opinions, or actions between individuals. Nurses can use problem solving and negotiation strategies to prevent a problem from evolving into a conflict. Common causes of conflict: ineffective communication, unclear expectations, poor organizational structure, conflicts of interest, incompatibility, management or staffing, and diversity. So conflict is the result of opposing thoughts, just like we said. Conflict is an inevitable part of professional, social, and personal life and can have constructive or destructive results. Nurses must understand conflict and how to manage it. Nurses can use problem solving and negotiation strategies to prevent a problem from evolving into a conflict. Lack of conflict can create organizational stasis, while too much conflict can be demoralizing and produce anxiety. Conflict can disrupt working relationships, create a stressful atmosphere. So common causes of the conflict, just like we talked about, that ineffective communication, that is the number one common cause of conflict. Now, we'll move into some categories of conflict. You have intrapersonal, interpersonal, and intergroup conflicts. So, intrapersonal occurs within the person and can involve internal struggle related to contradictory values or wants. So, an example of that would be a nurse wants to move up on the career ladder, but is finding that time with their family compromised. Interpersonal conflict occurs between two or more people with differing values, goals, or beliefs. Interpersonal conflict in the healthcare setting involves disagreement among nurses, clients, family members, and within a healthcare team. Bullying in the workplace are a form of interpersonal conflict. Interpersonal conflict contributes to burnout and work-related stress. I'm sure each of you guys have worked somewhere where there is a lot of conflict within the workplace, and it does cause an uneasy feeling walking into that building, not knowing who's going to be in an argument or what kind of disagreements they're going to be that day. An example is a new nurse is giving a client assignment that is heavier than those of other nurses, and when the new nurse asks for help, the help is denied. So that would be an interpersonal conflict. Intergroup conflict, let me move this just a little, occurs between two or more groups of individuals, departments, or organizations, can be caused by a new policy or procedure, a change in leadership, or a change in organizational structure. There is an example of this would be there is confusion as to whether it is the responsibility of the nursing unit or dietary department to pass meal trays to clients. Next, we will talk about stages of conflict. And this is also in chapter 32 of your ATI book as well, if you wish to back in your book. So the first stage is the latent conflict. This is the actual conflict has not yet developed. However, factors are present that have a high likelihood of causing conflict to occur. An example would be a new scheduling policy is implemented within the organization. The nurse manager should recognize that change is a common cause of conflict. The second stage is perceived conflict. A party perceives that a problem is present, though an actual conflict might not actually exist. An example of this is a nurse perceives that a nurse manager is unfair with scheduling. The nurse might not be aware that it is only because the nurse manager misunderstood the nurse's scheduling request. Lack of communication. Number 3, felt conflict. Those involved begin to feel an emotional response to the conflict. An example, A nurse feels anger towards the nurse manager after finding out that they are scheduled to work 2 holidays in a row. The next step, which is step number 4, is manifest conflict. The parties involved are aware of the conflict and action is taken. Actions at this stage can be positive and strive towards conflict resolution, or they can be negative and include debating, competing, or withdrawal of one or more of the parties from the situation. An example of this is the nurse manager and nurses on a unit agree that the current scheduling system is causing a conflict and agree to work together to come up with a solution. And then the last stage, or stage 5, is conflict aftermath. Conflict aftermath is the completion of the conflict process and can be positive or negative. For example, a positive conflict aftermath would be the nurse manager and nurses on a unit are satisfied with the newly revised scheduling system and feel valued for being included in the conflict resolution process. Now let's talk about a negative example. A negative conflict aftermath would be the nurse manager and nurses are both unable to come up with a scheduling solution that meets the needs of both parties. They agree to continue with the current system. However, tensions remain, increasing the risk of a reoccurrence of the conflict. And I'm sure we've all been in those situations within any type of career path that you might follow or go on has the potential for these conflicts. Okay, the next slide is conflict resolution strategies or problem solving. Open communication among staff and between staff and clients can help defray the need for conflict resolution. When potential sources of conflict exist, the use of open communication and problem-solving strategies are effective tools to de-escalate the situation. Actions nurses can take to promote open communication and de-escalate conflicts is the I statements. And remember to focus on the problem, not on personal differences. So use I statements, listen carefully, move conflict to a private location. You don't want it out amongst patients and caregivers and that type of thing. Share ground rules, steps of the problem-solving process. Number 1, you want to identify the problem. Then you're going to discuss possible solutions. You're going to analyze those identified solutions, select a solution, implement the solution, and then evaluate the solution's ability to resolve the problem. It's all about being transparent as well as that open communication. You also want to have active listening. You want to listen carefully to what others are saying and try to understand their perspective. You want to move a conflict that is escalating out of the bird view eye, out of everyone's eyesight, out of everyone's hearing. I'm really not sure what I was trying to say there. Forgive me. And then the very last thing, the evaluate the solution's ability to resolve the problem. The outcomes surrounding the new solution should be evaluated according to the predetermined timeline. The solution should be given adequate time to become established as a new routine before it is evaluated. If the solution is deemed unsuccessful, the problem-solving process will need to be reinstituted and the problem discussed again. Focus on win-win solutions or win-lose solutions. The negotiation is the process by which interested parties resolve ongoing conflicts, agree on steps to take, bargain to protect individual or collective interest, pursue outcomes that benefit mutual interest. The focus is on a win-win solution or a win-lose solution in which both parties win and lose a portion of their original objectives. Each party agrees to give up something, and the emphasis is on accommodating differences rather than similarities between parties. One nurse offers to care for client A today if the other will care for client B tomorrow. So there has to be negotiation. There has to be a give and take. Both parties know there is a conflict, but they refuse to face it or work towards a resolution. This is avoiding, or some might call it withdrawing, where that both of the parties, they realize that there is an issue, but they just don't want to face it. They don't want to work to try to resolve the issue. Another negotiating example is smoothing. One party attempts to smooth another party. This is often used to preserve or maintain a peaceful work environment. The focus can be on what is agreed upon, leaving conflict largely unresolved. The smoothing is usually a lose-lose solution. Next is competing or coercion. This is one party pursues a desired solution at the expense of others. The party who loses something can experience anger, aggravation, and a desire for retribution. This is usually a win-lose solution. Excuse me. Next is cooperating or accommodating. One party gives up something, allowing the other party to get what it wants. This is the opposite of competing. The original problem might not actually be resolved. This is a lose-win situation. Compromising or negotiating. Each party gives up something. To consider this a win-lose solution, both parties must give up something equally important. If one party gives up more than the other, it can become a win-lose solution. And then the last one is collaborating. Both parties set aside their original individual goals and work together to achieve a new common goal. This requires mutual respect, positive communication, and shared decision-making between parties. This is a win-win solution. Assertive communication and grievances. Use of assertive communication can be necessary during conflict negotiation. Some elements of this assertive communication is eye contact, I statements, stating your concerns, and avoiding personal attacks. Assertive communication allows expression in direct, honest, and non-threatening ways that do not infringe upon the rights of others. It is a communication style that deals with It is a communication style that acknowledges and deals with conflict. It recognizes others as equals and provides a direct statement of feelings. So, elements of assertive communication, which is what we just talked about: eye contact, I statements, stating concerns. You definitely want to avoid any personal attacks. And then with grievances, there's always a grievance policy at each of your facilities. They, within your facility, there will be a grievance process. There's usually a whole department over that. But a grievance is a wrong perceived by an employee based on a feeling of unfair treatment that is considered grounds for a formal complaint. Grievances that cannot be satisfactory between the parties as far as being resolved can require management by a third party or like a mediator. Facilities have a formal grievance policy that should be followed when a conflict cannot be resolved. Typical steps of this grievance policy started at the first level of management and continued up the chain of command as needed. There could also be a formal hearing if the issue is not resolved. And it could also turn into legal matters where that a mediator would have to be involved to negotiate between each person. Most of the time, the facilities will try to solve it in-house, though. It very seldom ever goes to like legal action unless it's something really serious. Like I said, you can look in your ATI book, chapter 32 goes over communication and conflict management. If you have any questions, please don't hesitate to email me. You guys have a great day. Thank you.